Hello and welcome to Physio Classroom. In this video, we are going to talk in detail about the fourth treatment procedure given by McKenzie to treat neck pain patients, which is cervical retraction and extension exercise with traction and rotation in supine line. Majority of the patients gets benefited and recover completely over a period of time by utilizing the first three procedures given by McKenzie. But in certain situations, when patient's improvement reaches a plateau phase or when the first three procedures are unable to produce further improvement or change in pain symptoms, in that situation, we can utilize the fourth treatment procedure. This treatment procedure is completely therapist dependent and cannot be performed by the patient alone. And this treatment procedure should be utilized only for 2 to 3 sessions. The therapist records the pain intensity and location of the most distal symptoms prior to performance of the exercise. The patient is made to lie down in supine position, and then the therapist asks the patient to gradually move out of the couch in such a manner that the head of the patient is supported by the two hands of the therapist. In order to successfully perform this treatment procedure, the hand placement of the therapist is very important. The lower hand of the therapist should be placed in this fashion so that it is holding the upper cervical spine just below the occiput, whereas the upper hand is placed right under the chin in this fashion. So once the therapist is holding the patient's head in this position, the therapist must first instruct the patient that in any situation when during the procedure, if the pain of the patient increases or peripheralizes, he can simply raise the hand as a sign of termination of the procedure. So the therapist should instruct the patient to stay as relaxed as possible and then apply a longitudinal traction in the backward direction. Now the traction force should not come from the shoulder muscles but instead by simply shifting the body weight backwards. So once the traction force is applied and maintained by the therapist should next apply the passive retraction movement in the cervical spine. So after retracting the cervical spine, the therapist gently guides the head and neck into progressive range of extension up to the tolerable range by the patient. So once the end range of tolerable extension is achieved by the therapist, from where any further movement of extension will result in increase of the patient's symptom, what the therapist should do from here is to gently relieve the traction force by half and then guide the cervical spine into slight rotational movements by moving the head and neck in such a manner that the nose moves about half an inch from the midline. This movement should be repeated for about 5 to 6 times before returning to the neutral position. The effect of one repetition should be recorded, and if improvement is present, then the procedure should be performed for about 5 to 6 repetitions, and every time trying to increase the range of cervical extension before returning back to the neutral position. So this treatment procedure should only be performed for 5 to 6 repetitions in a single session and should continue for a maximum of 2 to 3 days. The therapist should instruct the patient to perform the third procedure as a maintenance exercise to this procedure, which is cervical retraction and extension movement in supine line. And this movement should be carried out by the patient at home to maintain the positive effects obtained by the procedure 4. This treatment procedure is the third progression of McKenzie retraction and extension exercise, and the traction forces that were utilized in this procedure not only helps in significantly increasing the cervical extension range but also enables the therapist in providing relief to patients with severe acute posterior derangements of the cervical spine. So keep learning, keep sharing, and stay connected.